Hey there, welcome back. I'm Dr. Barbara Woods, and we are on live with the Intergenerational Trauma Therapist Show. So today we are talking about healing intergenerational trauma, a developmental trauma for children and teens, because this is one of the key parts of addressing intergenerational trauma. So what we're going to be working on today is we're going to do a brief review of understanding developmental trauma in children and teens. We're going to look at the Intergenerational Resilience Method as a way to support the healing of these children and teens. And that method involves increasing the autonomic regulation in the family system, increasing earned secure attachment, addressing developmental impacts, and building connection and family resilience. So it's important to understand and address the intergenerational trauma and this developmental trauma for improving the dynamics in the family and the overall mental health of family members. So this is because the family is really the context and the container of the child or teen's trauma and healing. And if it isn't addressed, the healing of the child and teen and the family is fairly limited. Sometimes kids with developmental trauma can be very traumatizing for adults to work with or to parent. So it's really important that multiple levels of this trauma are addressed, including the unresolved trauma of the caregiver, the developmental trauma in the child or teen as well. So just a brief review of developmental trauma. These are traumatic experiences which occur usually around conception to 21 years old. That's the developmental time frame. And they usually include a traumatic events over time, multiple events, and it impacts attachment in relationships. So those are the two key things based on Van der Kolk and Spinazzola, I think. So the impacts of these, they impact so many areas of life. There's a lot of variation in how they impact, and it's very individual to each child, each teen. Even within the same family, the children may not have similar impacts. So the domains that developmental trauma impacts are attachment, biological development, affective regulation, dissociation, behavioral control, cognition, and self-concept. So those are huge, huge areas that can be very difficult if they're impacted due to intergenerational trauma. So the impacts are very significant in the current generation, but also if they're not addressed, this is one of the mechanisms that transmits intergenerational trauma to the next generation as well. So it's really important. There's two levels of stopping this intergenerational trauma transmission. It's resolving the caregiver's unresolved trauma and addressing the child and teen's trauma to prevent it being passed down to the next generation. The Intergenerational Resilience Method is something that I developed out of just pure clinical work. I work primarily with children in care, a lot of intergenerational trauma. So I kind of pieced together a lot of polyvagal, interpersonal neurobiology, family therapy, and came up with something that worked. And then after I looked at it, it was like after I put it together in a program, it became this efficient and effective framework for treating it. So then I looked at the components and figured out how it aligned with the current research. So we need to have an efficient and effective framework for working with these families because they may have chronic disempowerment where they feel like nothing will ever work. So it's not even worth trying. And when they're at that level, they need quick wins and they need to build hope along the way. And if we can build hope in their healing by addressing the root causes of the intergenerational trauma and its transmission, we get a lot more effective outcomes. We get better engagement, longer stays in therapy, not dropping out. So it's really important to have that framework, but also to have some flexibility to meet the current needs of the family and maybe use additional interventions like EMDR, brain spotting, to address some of the more difficult parts that aren't resolving within this framework or maybe need a little extra support. So there's 4 steps in the intergenerational resilience method. It includes improving first the autonomic regulation within the family system. So this is like calming the family nervous system. May not be fully regulated at this point because we are doing this through parent coaching, which will help the parent become more regulated, which will help co-regulation, but we haven't addressed either of their trauma yet. We're just trying to take the heat out of the family system or add a little warmth if there's a little disconnection and numbness that has happened as well. Second step is to increase earned secure attachment in both the caregiver and the child. We want to create and strengthen this earned secure attachment so that we're impacting that transmission and we're stopping that part of the attachment aspect of the transmission of intergenerational trauma. Third, we need to address the developmental needs. That's what we're talking about in this particular episode, because these developmental impacts are very significant. And again, they are part of the transmission. So when we address these developmental impacts, there's a synergistic impact or effect that the developmental impacts are addressed that are either directly related to attachment or may have significant influence on attachment and parenting. So if we can address the developmental impacts and reduce some of the difficulties that in parenting when there's poor behavioral control, poor emotion regulation, we're obviously addressing the attachment aspect. If we can address those, then the relationship becomes more secure and we're reversing and impacting those intergenerational trauma impacts. The fourth step is building connection and family resilience in the family system. So we want to enhance those connections between family members. And we also want to integrate the resilience from previous generations. So a lot of times you'll see in these families that there's a family member that may have been a really strong advocate, but got into a lot of trouble for protesting or things like that. And we want to look at that as a factor of resilience, where we can integrate that in the current family to have them harness some of those good strategies and good resilience aspects and kind of create harmony within multiple generations of the family. So intergenerational trauma, it impacts the entire family system. When it's present, it impacts every family member from grandparents, parents, children, and the next generation. So individual interventions, they're not comprehensive enough and they don't get to the root cause. So the impact on the family system is going to be less effective. So individual interventions have that limited impact on the family system and the intergenerational impacts of the trauma. So if we address the parent's trauma, this supports improved emotion regulation and possibly attachment, but it's not significantly targeted to directly impact the attachment. So the difficulties with only addressing the caregiver's trauma is it limits the impact on the family system. There's no direct impacts on attachment. There's limited impact on the child or teen's attachment and trauma. And it doesn't improve family resilience, which that family resilience is going to insulate and support the family in that healing and growth. If we only address the child or teen's trauma, it doesn't impact the parent's trauma. The parent's trauma is still going to be unresolved, and the therapy is going to have limited effectiveness because the family system isn't being impacted. And one of the main carriers of intergenerational trauma is that unresolved trauma in the parent. So it won't directly affect attachment as well. And it doesn't, again, address that family resilience. So the key principles and techniques of the intergenerational resilience method are based on autonomic regulation, increased earn secure attachment, addressing the developmental impacts, building connection, and family resilience. So now we'll go through the the phases of the intergenerational trauma program to show you how these are fit into the framework to be very efficient and effective. So the first phase is polyvagal parent coaching. So it's using polyvagal techniques and exercises along with attachment and a lot of co-regulation to reduce the parent's dysregulation. So if we can get the parent's dysregulation down, there's more opportunity for co-regulating the child, and also then that forms the basis of attunement and attachment. So this builds the skills and the foundation for attachment, which is co-regulation, and attunement that's very important in this situation. So it increases the earn secure attachment within the family system. However, we have not then treated the parent's unresolved trauma or the child's. So phase 2 is a polyvagal complex intervention for adults. And this directly addresses the unresolved trauma on the parent. It's consistent with phase 1 of the autonomic regulation, and it just builds more on those skills. It further increases their capacity for attunement and co-regulation in supporting that earn secure attachment to develop within themselves, but also with their children. So the consistent interventions throughout all 3 phases help support that healing, and it helps support understanding of the basics of healing and attachment and stopping the impacts of intergenerational trauma. But it also allows the parent to attune more to the child because they're going through parallel interventions, so they have a much greater understanding of what we're taking the child through and how they can support the child. So phase 3 has 2 parts to it. It has the part where they're polyvagal trauma interventions for children and teens, and then building connection and family resilience. So the interventions for children and teens, they directly address the child or teen's trauma, and it's consistent with that parent's intervention so that there's consistency and the parent can understand what the child is going through. There's a consistent language, but it's just done in a developmentally appropriate way for a younger child and generation. So there's 2 workbooks. There's a children's workbook, a teen's workbook. There's actually 3 workbooks because then there's the building connection and family resilience part as well for the parents as the children go through phase 3. So that there is that parenting support that's a review of the skills from the polyvagal parent coaching, and it's to just continue to support that improved attachment based parenting strategies. So the building connection and family resilience part of phase 3, it integrates and transforms the previous generation's resilience. So we look at way back in the family, like instances of resilience, like where do we find evidence that there's resilience within the family? Because if they've survived through what they've been through, there is resilience there. It may look like resistance, or it may look like acting out, but there's something about it that promoted the survival of the current generation. So we really want to emphasize that so that there's healing for this current generation, but in their connection to previous generations. And this can further enhance family relationships within the primary family or through connections with immediate family members or extended family, if possible and if appropriate as well. So now we're going to look a little deeper into each one of the pillars of the intergenerational resilience method. We're going to start with understanding autonomic regulation. So the autonomic nervous system has a huge role in the stress and trauma responses. It's directly impacted by trauma and stress, creates dysregulation, which ranges from defensiveness, like your fight or flight, to shutdown, which is like numbing, or disconnection, dissociation. So this dysregulation negatively impacts the co-regulation, emotional regulation, and attachment. So this is a really important part of doing this. I have done parts of this and people feel so much relief that they start to think that therapy's over because they feel so much better in the moment, but there's many layers to this. So the importance of autonomic regulation is really for that attachment, emotional stability, and mental health and wellness overall. So we address that autonomic regulation across the family. The goal is to calm that family nervous system through polyvagal interventions and increased earn secure attachment. So we are taking the heat out of a defensive family system, or we're adding warmth in connection into a dampened or a numb family system that's more disconnected. So when we do this both efficiently and effectively, it builds hope for family members and it shows them that healing is possible. The second pillar of the intergenerational resilience method is the importance of attachment and earn secure attachment within the family system. So attachment impacts, they're one of the most significant impacts of intergenerational trauma. It's really the core of the impacts and how it's transmitted, other than the genetic changes that can happen. So epigenetics. This is the one that we can kind of get in there and get our hands on. I can't go back and change somebody's DNA. I can only work with what's in front of me in the present moment within the family system. So the attachment disruptions in intergenerational trauma, they're the main mechanism for that transmission. That's why this is so important. And if we increase the earn secure attachment of the parent or child, this is the critical moment and the critical thing that we need to do and the critical intervention for stopping that transmission. So the polyvagal parent coaching in phase 1 has intensive interventions based on co-regulation, increasing earn secure attachment, and these are reinforced in the child and teen intervention in phase 3. So when we improve those attachment skills of the parent, the attunement, and their regulation, it stops the compounding impact of intergenerational trauma on the current child generation, but it also provides space to address the impacts of the developmental impacts of intergenerational trauma on the current child and teen, which then prevents transmission to the upcoming generation. When we are addressing developmental impacts, we have to look at those domains impacted. So just for a little review, there's impacts on attachment, biological development, affective regulation or emotion regulation, dissociation, behavioral control, cognitive development, and self-beliefs or self-concept. So there are some long-term consequences if we do not address developmental trauma. The impact on the individual is huge if we don't intervene and start to support building improved attachments and providing an environment where those developmental impacts can be addressed and either healed or remediated so that they aren't having a huge impact on them as they continue to develop. And these impact relationships, it impacts their education, employment, potential for incarceration. These impacts are huge on these children's lives. So if we can improve autonomic regulation and attachment, we can reassess these developmental impacts. And this would be kind of a secondary level of intervention after the intergenerational trauma program has been completed. You could take a little time in between and then reassess these developmental impacts. And the reason we want to do this is, for one, some children will look like they have ADHD because there's poor impulse control with the behavioral control that is lacking for these kids. But it can be the trauma and attachment impacts. So several problematic behaviors or concerns may disappear or decrease significantly after a period of stable attachment and co-regulation. So it's really important to allow the interventions to have their impact and then go back in and reassess what the child and teen may need. So continued support for the positive self-beliefs is also really important. These are driving beliefs that we all have them, but in instances of intergenerational trauma, these are really heavy and they're usually very impactful in relationships. So they create a lot of disruption in their ability to connect with other people because they may feel like they're not worthy of love, or they're unlovable, or they're not a good person, or they're damaged, or there's something wrong with them at a very deep level. So this is one thing that we really want to look at and really want to address. This also may take longer periods of time to address this because it's going to take multiple experiences over time of being regarded as a worthwhile person and experiencing a good, solid friendship where there's mutual caring, and it helps them develop a different skill set, but that takes a lot of time. So this may be one of the longer parts of the kind of the aftercare or secondary level of intervention. So school performance and cognition may improve with autonomic regulation and attachment. They may be able to attend more. They may be able to process information better because they're not hijacked in the stress response center of the brain. So it's important to look at that. And if they're not significantly improved with those changes in attachment and regulation, then we might want to look at some school psychologist assessments and interventions to determine what are the longer term impacts, or are there learning disabilities there. So this is where we may need to get into having a multidisciplinary team for the child. So think about sensory difficulties. We would want an OT involved. If we had some of the biological development impacts that are low muscle tone and coordination, we might want a physical therapist, might want a physician. I mentioned the psychological assessment for learning disabilities and cognitive skills. So this is where more wider systems may need to be involved to help support the children. And these referrals may occur months or even years after therapy in order to allow the cumulative effects to appear. And we really want the family in a really good, stable way of living in order to address some of these other difficulties. And sometimes we just need to get in there because these difficulties are going to disrupt the family system. So it's kind of a balance between which way do you kind of go? Do you let the effects kind of set, or do you need to intervene right away? So the last part is building that connection and family resilience. So the family resilience is the ability of the family system to remain connected over time and endure stressors without increasing that chronic autonomic dysregulation or significant attachment disruptions. So this is really important for the long-term wellness of the family. So if we integrate the resilience from previous generations in the current family constellation, That's part of that healing and building that connection between the current generation and previous generations. So the improvements that we'll see in the family system when we address building those connections and family resilience and harnessing and integrating the resilience of previous generations, we'll see decreased split loyalties. So you'll find sometimes the child will be aligned with a grandparent or an aunt against the parent. So this can be really, really damaging to the child because they learn that they can't balance two relationships that might be in conflict, and then they can't have solid, stable relationships with either party because there's this loyalty conflict. So this is really important because these split loyalties are very frequently found with intergenerational trauma. It may also decrease cutoffs from family members when it's safe to promote integration of these family members and that healing. So there may be a deeper connection to history, to ancestry, to previous generations if they've been cut off from those generations. And again, we always have to look at the safety, and that becomes the primary concern when we're looking at these cutoffs. But it's important to address these so that there's harmony within the much extended family system. We also want to identify any unconscious loyalties that create these repeated family patterns. So sometimes you'll see, if you do a genogram of a family, you'll have somebody who was incarcerated 3 generations ago, and a person in a current generation is kind of expressing the same types of behaviors or in the same situation. These are unconscious loyalties where these patterns get kind of passed down in generations, but it's not through genetics and it's not through attachment. It's more likely through the family stories, the history, and just the family dynamics. So we really want to address those because those are the things that benefit the family long term. So it's decreasing split loyalties, decreasing cutoffs, and identifying unconscious loyalties. So there you have it. That is the Intergenerational Resilience Method. And this is why it's so important to support children and teens as we go through this, because we don't want the developmental impacts that they've experienced to impact the next generation. So we've looked at understanding developmental trauma, just a brief overview again. We looked at the Intergenerational Resilience Method, which is the improving autonomic regulation in the family system, increasing earned secure attachment, addressing developmental impacts, and building connection and resilience in the family. So next week, we're going to shift to working with more complex cases and getting into some of the more dynamics that you'll find when you're working with families who've been impacted by intergenerational trauma and the complexity that it can bring in the therapy setting. So the first video will be on providing collaborative care for complex families. So that's working within systems and trying to get the best out of those systems for the most impact for the family. So I hope you have a wonderful day, and I will talk to you then.